So good morning, everyone. We have with us today, we have Blake Newmer. I hope I'm saying his name correctly. He is with LewerMark. He is here to show you guys about or talk to you guys about the new way we're going about our insurance choosing and things like that. So Blake, are you ready to take it over?
Yes, I am. Thank you, Monica. You actually
Hmm.
did say it correctly.
Okay, good.
Um, it doesn't happen very often. I get Newmeyer and all kinds of different stuff. So, yes, hello, everyone. As Monica said, my name is Blake Newmer. I'm with LewerMark Student Insurance, and I'm here this morning to go over the new insurance process for the 2025-26 policy year. And let me just get to where I need to be. Are
While you're working,
there?
while you're
Yeah.
working on that, Monica, can you make sure you can share his screen? We're just really excited to have you, Blake, and we know you're a local Kansas City guy, and
Yeah.
so that's pretty cool. And we've had a great relationship with LewerMark for the last few years with our international students as they've grown. I always like seeing you and the team at all the international conferences and stuff. And even state and local conferences. You're really big supporters of international education, and we really appreciate your help and your guidance. So thank you. Are you able to share?
Yes, and thank you, Andrew.
Sure.
So I'm gonna go ahead and go through. I'll start going through the LewerMark route. Share. Can you guys see my screen?
Perfect.
Cool. All right. Well, so when we arrive here on the LewerMark webpage, you'll see a search bar. It says search for your school. Of course, we're going to go ahead and search for Avila University. It's going to look similarly to what you might be used to when you search for insurance previously. If you needed to come find, important documents, you would come here to this landing page. Once you scroll down here, we're going to have a shopping cart to link to the Avila webpage where you can purchase your student insurance for the 25-26 school year. Under important information, there's also going to be dependent coverage options if that's applicable to you. Most of the plans that we're offering this school year do have the option to add dependents, and we can go through that in just a second. So we'll go ahead and click on the shopping cart, and we'll be redirected to the Avila University landing page. For those of you that watched my video, I did answer the question of why we've got this short form in there. For those that didn't, this is to essentially help Andrew and I narrow down who has enrolled in the insurance. So just bear with us with this. I'm going to go ahead and enter my information, and then I'll just enter a random birth date, and then I'll enter my email address, and then we'll go ahead and click submit. We'll then be redirected to the available plans for Avila University. I'll just go ahead and get rid of this chat box down here. Once you scroll down, you'll see some helpful information. Your school has laid out preferred enrollment dates for you. So whenever you're going through the insurance application, this is a good reminder of the dates that you should be enrolled for your insurance. It's not, these dates don't have to be set in stone. You can customize a little bit, but this is a good thing to go off of. What are
Yeah.
travel dates? What's
Yeah.
that, Andrew?
Yeah. So these are important dates that you've indicated for us. So
Yep.
it's required that all international students have health insurance the whole time that they're studying. So yeah, so Blake mentioned that it's, that you're able to, if you went home and had a vacation or something, you could alter your coverage a little bit. But I think the idea is that you have coverage the entire year. Is that right, Blake?
Yeah, that is the idea, is that you have coverage throughout your entire time you're studying. If you're returning home, of course, you won't need coverage, but it is pretty important to keep these dates constant and without gaps. Okay, and so we've got some frequently asked questions down here, such as what are your travel dates? What is my country of residence? I'll go ahead and show you where those are located on the plan application. Up here, you'll notice the age slider. As you move this, rates will increase, decrease with your age. This will help you get an accurate quote before you ever fill anything out. So did you guys want me to go ahead and go through the purchase process on these two?
Yeah, that'd be great. Thanks, Blake.
Okay, yeah, no problem. So first and foremost, to help you decide which plan is best for you, of course, you'll have your budget in mind, whichever looks best budget-wise, price-wise. And then we'll also have the plan descriptions down here. Once you click on that, you'll be reloaded to a place where you can view your plan description, see benefits associated with the plan. Go ahead and go back. Same with the Patriot Exchange plan description. We've got some information listed up here on the plans, but best to take a peek at the plan description to see what you're getting into benefits-wise. We'll go ahead and start with the F1 plan. I don't believe I went over this one in my video, but this is the easier of the two applications. Super simple enrollment process. Are you guys still following with my screen?
Yep, looks great.
Cool. All right, I'll go ahead and enter my age in this fantasy world. You'll notice you'll have the option to add spouse and dependents, if that's applicable to you. Start date, I'll go ahead and just toggle back here. Check out these dates that we were given, 8/25 to 1/11. Okay, got our dates entered. Country of citizenship, this is going to be the country listed on my passport most commonly. Country of residence, so the FAQ, what is my country of residence? This is your country of permanent residence. Do not enter the United States as the country of residence. This is confusing to a lot of students because, they say I'm living in the United States. I'm here. I'm studying in the United States. I'm not going home. This is where I'm permanently residing.
Thanks for clarifying that, Blake.
Yeah.
I already received 3 emails about it yesterday.
Yeah.
So I'm glad it's there.
Yep, that's that and travel dates. We'll get into that on the Patriot Exchange. The travel dates are a bit confusing as well, but the residence country is where a lot of students get tripped up. It's going to be the country that you reside permanently outside of the United States. So just because you're living in the United States for now doesn't mean that that's permanent until you have a green card or citizenship. So usually that's going to match your citizenship most generally, not all the time. So if you have any questions, feel free to reach out, and I can help guide you through that. Primary destination country, that's going to be the United States. We're going to go ahead and see prices. So we make it here, preferred currency, payment frequency. We've got the term, 4 months and 18 days. And then down here, we see a little customizable section. You've got a $0 deductible and a $100 deductible. You'll see a couple different costs. Andrew, did you guys, are you guys just letting students decide here, or is there a preference?
No, it's up to the students. Yeah, this plan's really awesome because it has so many options for students. And
Yeah.
maybe you wanted to just explain just a little bit about deductible.
Yeah. Yeah. So the deductible is the amount that you pay per injury or illness before insurance starts to pay. So let's say, for example, you're going to the emergency room, you've got a broken arm. You will need to meet your deductible, pay that amount of money. We'll say it's $100 in this situation. We'll pay $100, and then insurance will kick in and begin to pay for the rest of the cost that you're billed. Let's say we have the same situation, but we've now selected the $0 deductible option. So no cost is applicable to me. I won't have to pay anything, and then insurance will kick in and pay up to $500,000, which is the plan maximum. In scenario A, I'm paying $100, and then after I pay and meet my $100 deductible, insurance then kicks in and pays up to the $500,000 maximum. So you'll notice roughly these are about $130 difference. So it just depends on you and your essentially I would base it off how often you how accident prone you are, how risk adverse you are, is kind of what I would base it off of, because essentially you're over time you're paying for that extra deductible cost. But in the long run, if you're using your plan all the time.
Sorry, Blake, if I could just interject real fast. This is all really good. This is a really good plan. I wish this, Avila employees were eligible for this plan. This is really good. So everybody, I see some hands are raised and stuff. So we'll answer questions at the end of Blake's presentation. I just wanted to get that out there. Thanks, Blake.
Oh yeah, sorry, I can't even see my screen.
Yep, yep.
Okay.
It's okay.
Okay, so yeah, we can go into more customizable stuff after. One more thing that's really nice about this plan that I know students tend to really like is the option to pay monthly. So you can break these payments down in a monthly cost. Renews automatically for that 5-month term. Or you can go ahead and pay the full premium at once. You'll notice that when I click over to monthly, it switches to 5 months. It's got to be a full month. So there's the monthly costs. And then we'll go ahead and for the sake of this, we'll go ahead and select the $100 deductible on a monthly basis. Once we make it over here, we've got our first and last name, our date of birth. I'll just put that for the time being. Gender, government issued ID number. You don't have to enter that. Visa type, I'm an F1 today. Go ahead and check my important dates. These are my coverage dates. Address, we'll go ahead and put Avila University. Once you get to the residence address, they're actually going to want you to put your home country address. You'll notice that when you come down to country, you're selected United Kingdom of Great Britain. They want your home country address. This is just to confirm that you have residence outside of the United States. Nothing is sent there. Everything is sent digitally to your email address. Go ahead. I'm blanking on what city Avila's in, so we're just going to I'll just put Lenexa for now. I know.
Yeah, we're in Kansas City.
Kansas City. Okay. I knew it wasn't Lenexa, but I didn't know. It's probably in Missouri too, isn't it?
It is, correct.
Yep.
So see, you know more about Avila than you thought.
I did, but Lenexa is totally not Missouri. Anyway. So obviously this information I'm putting in is not the United Kingdom.
Right. But this
But
will be the student's home country address.
yes, and
And their
yeah,
telephone abroad.
yep. And a lot of questions will come up about that, understandably so. Um,
But for the sake of this, you're just inputting just any kind of information to get us to the next screen, right?
yeah.
Okay, no worries. Yeah, so students, this will be your residence address is your home country address.
Yeah, and the way I like to break this down is so I use it so if I were to be traveling to the United Kingdom and we'll say that I'm there on an extended stay, we'll say that I'm studying there for a semester, but I need insurance as a US citizen. I'm not covered while I'm over there. And so whenever I go to purchase insurance, I'm not a permanent resident of the United Kingdom. I might be there for a long period of time, but my residence lies back in the States. And whenever I'm purchasing insurance in the United Kingdom, they're not going to insure me there if I'm a permanent resident. So that's why they're requiring me to enter my home country address. If I'm a permanent resident, I wouldn't have access to this coverage. Just like me, Andrew, and Monica couldn't enroll in these plans because we are permanent residents of the United States. These plans are not available to us, as great as they are, as much as we would like to have them. They are not available to us. So that kind of breaks down um, why I'm entering my residence the way I am. And so we'll go ahead and move on. There's a function to save the application if you need to come back later. Oh, so there you go. It won't let me move on because I'm only supposed to select the state if it's the US or Canada. So let me go ahead and remove that. So these are just a couple of optional riders that students will get the option to purchase. Adventure sports, um, pretty daredevilish activities. If you like to whitewater raft, if you like to rock climb on the side of a mountain, it's not just your typical sports, such as baseball, volleyball, um, hockey, things like that. They're actually, you can see them here. Oh, they aren't listed, but BMX, things like that, where there's increased risk. Device protection. This is like a phone insurance plan built into your medical insurance. Most people already have phone insurance or don't want it, so I just always say no to that. But it's there if you need it. Continue. You can see my total due at checkout. I selected the monthly option. So this $539 cost is broken down over 5 months. And so I'm paying $112.11 a month. I don't have to worry about renewing my insurance for 5 months. I am good. Automatic renewals, $112.11 every month. Continue. Select payment type. Credit card, debit card. E-check is like a wire. You enter your billing or your bank account details. I agree. And then I've got my digital signature. Most of your guys' students aren't going to be under the age of 16. In my example, I think I selected that my birth date was 2025. So it's asking for a guardian signature. This will not typically populate. This is just here because I selected my birthday very funky. If there's any students that are 16, congratulations, because that's impressive. But yep, from here you'll select continue, and then a fulfillment kit is sent directly to your email. containing your ID card, instructions on how to enroll in the My IMG portal, where you can access your important documents and see claims information. Good stuff like that. Okay, now that we finished that application, do you guys want me to go ahead? Do I have time to go through this one as well?
Is it pretty much a similar process for signing up?
It's just about the same. Yeah, it looks a little bit different. I'll say one thing, and then the rest of it, yeah, it's about the same. Over here, yeah, go ahead.
Yes, probably after you show us the unique features on this plan, but basically it's the same. Maybe you could show us like where can we go, or how can we figure out where to go for to use the plan, you know, which hospitals are in network and stuff like that, maybe.
Oh, yeah, good call. Good call. I'll definitely do that. Okay, so once we click into Patriot Exchange, this isn't a form that we actually built. We're using IMG's form. So we've tried to get them to change this a million times from travel dates to insurance dates or something that makes a bit more sense. But your travel dates aren't necessarily going to be your travel dates over here on the helpful information. Your travel dates, your travel start date is when you want the insurance plan to begin, and travel end date is when you want the plan to end. So basically your insurance coverage dates is what will be your travel dates. So if I want coverage from tomorrow, I'll go ahead and select from tomorrow. And then whenever my school year ends, we'll just go ahead and say January 1st. It says travel dates, my travel duration, it's my coverage dates. Those are the dates I'll be covered under the insurance. Okay. So once you actually enroll in the insurance, you'll be sent a fulfillment kit with information about how to enroll in a My IMG account. For now, I'm just going to head over there, show you guys under my account. Come down here to member login. And you'll get a direct link to this, but just for the sake of being on the website, create an account, and then you'll have your certificate or policy number. When you click continue, you'll enter your date of birth. Just wanted to show that real quick. To find a provider, under resources, we've got a find a provider tab. Is also included in the email write-up that Andrew sent you. I've also got a link to create an account, a My IMG account, located in that email as well. With instructions, because finding a provider, there's some different options. So in my instructions, it says search the network for your healthcare provider. Search the provider network, options PPO. So Casey Mo 64105, that looks accurate enough. We'll just see. So is there a provider close by you guys that might be worthwhile to search up?
Let's see here.
St. Luke's.
Yeah, St. Luke's would be it.
St. Luke's. Any of these look correct?
Yeah, that's St. Luke's for sure.
Cool. Okay, yeah, so St. Luke's, I mean, it's United Healthcare. It's an options PPO, so you get coverage in and out of network. But these are in network, accepting all patients. I mean, there's a hospital, so they're not going to turn you away. But in network, so you will be covered at the 100% co-insurance. If we go back,
That's great.
And
Thanks, Blake. What about places like CVS and smaller clinics?
sure. So if you'd like to search for CVS and smaller clinics, we'll go over here to places.
Okay.
Go ahead and click on clinics. And then we'll go ahead and do a convenience clinic, is I think where we'd see a CVS. So here you go. Minute Clinic located inside CVS. It looks like one, but you can see we can see 20 additional locations. So CVS is in network. You can go to any CVS walk-in clinic, and the plan will cover.
That's
There's
really helpful. So we have
yeah.
all of our international students take bus 57, which connects a lot of apartments and goes past campus, and it
Okay.
also connects directly to a CVS over by State Line, 135th and State Line. So that's really helpful. Thanks, Blake.
Cool. Yeah, no problem. And one more. So we've got urgent care clinics over here. Quite a few of those as well. Looks like St. Luke's is on here. Their convenient care. What type of place? You can select hospital here. See the different hospitals. And when I said earlier that you're covered at 100% when you go to the hospital, just make sure that it's an emergency service. That's what hospitals are for. I'd just like to be clear. If you have a headache, for example, it might be a better option to go to a CVS Minute Clinic. And if you have any questions about what you should go to these providers for, just feel free to reach out. We can help guide you through the process. But if you have an emergency, go to the hospital, and then you'll be covered at 100% there. Just wanted to make that clear. Okay, back to the website. If you are a grad student and you've entered your OPT period, we've got OPT plan options. Here are the options here. You'll notice they're pretty similar. The cost is a little bit less, but those are there for you if needed. If you graduate and you're no longer, if you're changing visa status, no longer eligible to be on an F1 plan. Dental and vision, we've got a few different options here. We've got dental insurance plans, vision insurance plans, and then we've got probably our most popular option, the Carrington Dental and Vision Discount Plan. The Carrington Dental and Vision Discount Plan is exactly what it sounds like. It's going to get you discounts on both dental and vision services. Essentially what Carrington does is they partner with different dental and vision offices. And if you go in and show them this card, they'll give you 20 to 50% off your service. And I've seen them cover just about every dental or vision service. And the reason it's popular is because it's about $35 for the entire year of coverage. So it's pretty cheap. You get a year of coverage for pretty low price. So if you have any questions on that, feel free to reach out. Dental and vision is not covered in the medical insurance plan. Dental and vision services are separate unless, we'll say, I use this example a lot. It's not pleasant, but if you were to like fall and hit your face and knock your teeth on the asphalt, we'll say, that's a dental injury that'll be covered under your insurance plan. But routine exams, cleanings, vision tests, you'll need one of these plans, and I can help you figure out which one. Outside of that, I think we've been through just about everything. Do you have anything to add? Yeah, no problem.
So can you just show how the communication channel that you would like students? I know the chat box with the real people has been really, really helpful. When you say students contact you, how would you like us to, students with inquiries, how should they go about that?
Yeah, okay. So on the LewerGlobal site, you'll notice this chat feature down here. Usually it's got someone popping up. They might be in a meeting right now, but if you leave your email, your insurance ID, and your question, someone will get back to you. Click start chat. They should be there. Let me go check on LewerMark. So generally, and you would have seen this popping up at the beginning of my presentation, it was actually Jeanette down here who's in the same exact office as I am.
Oh, really?
Yeah, exactly. So we've got real people on the chat from 8 to 5, and it's kind of interesting that they're not. They might be in a meeting, but
It could be
just in case. What's that?
Maybe when it popped up earlier and you said, I don't want to chat, then it probably dismissed you.
Yeah, that could be.
Could you also so one option is this chat, and then they could email like what's the email? Could you put it into the chat?
Yeah, the email. We're gonna have you guys.
Yeah.
Oh, I accidentally clicked on that. We'll email our support team, and then our support team will be able to answer your question. And if they can't answer your question, it'll then get redirected to me or IMG. Oh, thank you, Monica. So the things that we would redirect you, we're not going to just ship you off to IMG just because we don't want to deal with your question. The reason that we would send you to IMG is because you have a claims question that we can't answer. IMG is going to be the one dealing with the claims stuff. So those questions will be redirected to IMG. If you have questions about your policy, like your plan benefits, you need to renew your plan, just general questions, we will be able to answer your questions here in-house. The only way we would send you to IMG is if you have a claims question or something's wonky with your premium. But we'll be able to cancel your plan if needed. We'll be able to do all that in-house.
Great, thanks. That makes sense. Okay, very good. Let's see, what other common questions do we have? Well, maybe now we could open it up to the students or any of the DSO. If they have some further questions or things. Is there anything that you'd like to expand on? Monica, you want to read through the chat some of the questions? Oh, I think Blake, one of the questions that just popped up is so some of our students, they're transfer students from a different university. Some of them have insurance from other institutions or have already purchased insurance. So how do students go about applying for a waiver? And what are the conditions for a waiver?
So I created that. So basically what I did was I took the LewerMark waiver form and I basically put LewerGlobal on it just so we weren't confusing anyone. But can I attach that and put it in the chat? Is that an option?
I think Monica will be able to, when she sends out this video to everybody, she'll send it to an email.
Cool. Well, I'll be able to send that to Monica then after we jump off here. But essentially, we want if you're going to waive out of these plans, we want you to have an ACA compliant plan. And in the past, what that's looked like, we've seen a lot of Oscar plans, a lot of Aetna plans, a lot of plans that can be purchased through the marketplace, is what I've seen students waiving out with. And there's more information on the LewerGlobal waiver form. It's all listed what kind of plans. If you're on a spouse's plan, if you have coverage from your home country, there's SACM plans are eligible to be waived. But essentially what we want you to have is coverage that is equal to or greater than what you're getting from the LewerGlobal plan. That's the biggest piece.
Could you stop sharing your screen?
Oh, yes. Sorry.
You're fine.
Okay, there you go. But yes, I will send that form to Monica when we're done on here. And I think, Andrew, did you already attach that to
Yep,
your
and we
email?
yeah we sent out the email yesterday with all the attachments and video.
Cool.
So yeah, I think we probably already have it. So
Great.
thanks.
I have a
Um,
question. Is dermatology?
Monica, we can
uh,
barely hear you. Could you
Oh,
sorry,
is it better?
yeah,
perfect.
yep, perfect.
Okay. We have a question. Is dermatology coverage included in this plan?
So, so dermatology is a bit tricky. A lot of time, dermatology is considered elective. For example, the plan doesn't treat acne. It's considered elective. But if you've got an unexpected um, injury or illness regarding dermatology, like if you develop a rash, something like that would be covered. But acne, like if you want to go and get medicine because you have, bad acne, which is understandable and it's not great, but it is elective because it's having to do with your altering your looks is what the plan deems it. So it kind of depends for dermatology.
Okay. Question. Do I need to purchase LewerMark insurance if there are no hospitals in my area that accept it? So I think that the student is a bit confused on what the coverage actually is.
Okay. So the the plan is in network with United Healthcare PPO. It's the largest network in the United States, um, and it would be really hard. I mean, there are some very remote areas that don't have in-network providers, but it'd be really tough to not find any providers near you. So if you'd like to reach out to me, I would be more than happy to check your area. But if you have a different plan that you'd like to waive out with, that is better for your area, that is okay as well.
Yeah, and I think it's important for our students to understand that LewerMark is not our insurance. United Healthcare is our insurance.
Yeah,
So when you go and you speak to people and they ask what type of coverage you have and you say LewerMark, they're not going to understand what you mean. However, if you go and you say I have United Healthcare, you'll be good to go.
that's a great point. Yeah, that's a really good point. That Monica just said. Um, don't state the name. So like now we're gonna have LewerGlobal or International Medical Group. The network that you're in is United Healthcare PPO. If you state that network at the doctor, they're gonna know what you're talking about. Um, if you say LewerMark, LewerGlobal, they're gonna send you away because they don't know. Unfortunately, I wish everyone knew, but um, they don't. Um, and so just be sure to state the network name. In this case, it's United Healthcare PPO. Should I just start going down the list of questions?
Everything else is OPT, but our last
Okay.
question for insurance is for those who had the LewerMark insurance plan last term, do we need to take any actions to renew or waive this term?
Um, so you won't be renewing the LewerMark insurance plan. So there's no action that you'll need to take unless you need to purchase insurance for LewerGlobal. If you do have a waiver plan, please do send that to our waivers at lewermark.com email, and we will review and get back to you. So the only action you would need to take if you have a waiver, please do send that in for the fall semester. Outside of that, no action will need to be taken. You won't be charged to your student account for any insurance. You'll need to purchase that on your own this year.
So Blake, I know there's another question in the chat about adding dependents. So I know you showed us earlier in the video where you can add like, you know, spouse or children to the plan. So I guess that's that answers that. And I guess so the cool thing about this insurance is that it's, you know, you can kind of toggle your age and the amount. So then you can figure out, you know, it adjusts coverage based on how old you are, right? And so your children and husband, it'll all be variable, which is really good.
Yeah, exactly. So I mean, the younger, you know, if you have a spouse, you know, usually the price will be pretty comparable. It'll be like paying for the two insurance plans together. But if you've got a younger child on the plan, you're going to be paying significantly less to insure them as well. But you can use that age slider on the website to get a better idea of what you're going to be looking at in terms of premium.
Good stuff. Well,
All right.
I just want to thank Blake. It looks like Monica had the all right. That's her wrapping things up all right.
Yes.
So
Yeah.
we'll, Blake, we'll let you go. We appreciate it. We look forward to welcoming you back on campus for a new student orientation. Of course, we have our low residency orientation coming up too, and getting to hang out and with you more often. We've got a lot of actually a lot of events coming up, all the residencies and stuff. So thanks a lot, Blake. Very knowledgeable, and we appreciate your support for our international students. So you can leave, and then we'll talk about some other stuff that we have to talk about with our group. So we'll end the recording. Yeah, thanks, Blake. We'll end the recording now and answer questions. Thanks, Blake. Have a good day.
Thanks. You guys too. Bye-bye.
Yeah.
Bye.